The UK's National Health Service, or NHS, braces for the most disruptive walkout in its history as junior doctors across England are expected to stage a 4-day strike. Well, more than 250,000 appointments and operations are expected to be cancelled, with some hospitals reporting that almost half of all the planned treatments are likely to be disrupted. Well, according to NHS estimates, between 250,000 and 350,000 appointments and operations could be cancelled. However, the union said doctors will report back to duty if lives are at immediate danger. Well, the junior doctors' approach is diametrically opposite to recent strikes by nurses and doctors, as they exempted certain emergency services. Well, Health Secretary Steve Barclay accused unions of timing the strike just after Easter weekend, as many hospitals are expected to see a surge in demand. Barclay has termed junior doctors' demand of 35% hike in pay as unreasonable. Well, last month, a 72-hour strike by junior doctors led to more than 175,000 patient appointments and procedures being cancelled in England. Junior doctors represent nearly half of the medical workforce in England. Well, for more, our correspondent Alex Isaac is joining us live from London. Alex, good to see you. So 4 days, the biggest strike in NHS history. How much of an issue is this going to be?
Well, the NHS themselves, leaders, have been saying that they are very worried, specifically because it comes after the 4-day weekend when services were at a minimum anyway, and then following on for another 4 days of the junior doctors being on strikes. They are expecting for some disruption to patients. You talked about cancellations there of appointments. Those appointments that have been backdated since COVID still haven't got a space. Then we had the doctors and nurses strike, and now we've got another one. So all of those procedures are ongoing, and at the moment there is a real problem within the NHS as there aren't enough doctors and there aren't enough those NHS workers coming into the jobs themselves. So BMA, the British Medical Association, who are behind these strikes in England, have said that they will ensure there are contingency plans, and as you rightly said just there, if anything happens emergency-wise, they will take doctors off the picket lines, junior doctors off picket lines, and make sure that they can go in to the hospital to cover those shifts. So they are expecting to be able to make sure that all patients are safe. The NHS are still worried. At the moment, the Health Secretary, Steve Barclay, won't come to the table to discuss the pay that they're asking for, that 35% increase. He says that he won't talk to them about pay unless the strikes are called off. Well, that was obviously on the weekend as well. He hasn't really said anything today, and it looks like the strikes are going ahead, but whether or not they'll stay for the extra 3 days from now will be seen, unless Health Secretary Steve Barclay comes to the table to talk to the BMA and to discuss pay going forward.